So today we are going to discuss about compromised donor areas of the scalp which may preclude the procedure. So as you all know, the donor area is limited. The grafts that are available to us are limited. So the two important variables which determine the success of a hair transplant, number one, the Norwood scale, and number two, whether the donor area which is available and which is limited will be able to meet the demand for now and for future balding in times to come. So this is very important, how you balance the availability of the donor supply on one hand and the Norwood scale or the extent of the baldness on the other. So this talk is basically about conditions in which the donor area is limited and which may preclude carrying out the procedure. An adequate supply of grafts and integrity of the scalp are two important prerequisites before we plan a procedure. So before we proceed, we must understand what is a scalp donor. So in these pictures, you will know that a scalp donor is an area in which consistently we find grafts which are mostly anagen in nature. There is very little miniaturization, and through examination by a doctor and through eliciting the patient's history of baldness in the family, we determine that these areas will remain for the rest of his life. On the health of this zone depends the long-term results of a hair transplant. This is provided a patient is above 25 years of age, and we will do another video to show and to discuss why patients who are 25 and above only are eligible for a hair transplant in androgenic alopecia. I'm not talking about traction alopecia. So let's discuss the conditions in which hair transplant may not be done, or if it is done, it is done within limitations as discussed with the patient. So I've divided the causes into genetic, hormonal, iatrogenic, immunological, infective, scarring, obesity, irradiation, and decreased contrast between the skin and the hair, which is becoming more and more a problem with people going in for scalp micropigmentation and tattooing over the scalp. So we will discuss this one by one. Firstly, genetic. So in certain grades of baldness which are extensive, like grade 6 on the Norwood scale, grade 7 on the Norwood scale, we might not be able to get adequate number of grafts to meet our objectives and to give a result which is satisfactory for the client. Also, when there is reverse balding, that is the balding or miniaturization starting from the neck upwards, which constricts the permanent donor zone and does not allow us to take as many grafts as we would in this patient who suffers usually from extensive baldness. Alopecia totalis, where very few hair follicles are available in the entire scalp. A few may be available, but they are so few that no semblance of a proper procedure can be done with them. So these patients are totally unfit for a hair transplant, and there are other treatments which are available for them. And certain vascular malformations which affect the scalp, and even if they heal, they leave a stigmata or a scar which compromises the donor area. In this picture, you can see it's a small scar, but this picture is just representative. You can have much bigger scarring as well. And lastly, a congenital disorder, which is not so common, but we have seen in our practice in about 4 or 5 patients, called Cutis, Verticis, Gyrata, or CVG. In this condition, there are so many folds that it is so difficult technically to stretch the skin and be able to take grafts out with minimal transaction rates. So it's a very tough thing to do, because usually it is also associated with a lot of subcutaneous tissue, where it is firstly difficult to numb the area, and secondly, it's very difficult to extract the grafts. In these cases, when you do these cases, you have to put the patient to sleep, because otherwise there will be a lot of complaints about pain, because the skin is such, the underlying tissue is such, that it's very difficult to target the nerves while giving local anesthesia. So this is to be noted. Then coming to the hormonal factors which decrease the donor area. Number one is DUPA, or diffuse pattern alopecia, in which there's so much of miniaturization that anagen grafts are very few and far between. It's difficult to get adequate number of grafts to do the procedure. So since these hair are miniaturized, some patients, some clinics give their patients 3 months finasteride course, and once the grafts are good enough, they are harvested and planted. The problem here is that once the effect of finasteride is over, these grafts will go back to their original condition and interfere with the result. So these cases are only taken up for surgery in very rare circumstances, when the patient is willing to take finasteride or dutasteride for a long period. And then we have hormonal acne appearing in the scalp donor area and the recipient area in crops, which just won't go away. You treat them and they will again come back. And especially when the patient is stressed just before the procedure, they will definitely come out again. Iatrogenic means causes which are related to medicine. Now these can be, number one, it can be because of an allergic reaction, or it can be because of certain blood thinners given in patients who have cardiac problems and who take aspirin or other blood thinners for a long time. So in these cases, you cannot take them up for surgery till such time the coagulation profile, the bleeding time and the clotting time are fine. So for this, we need to stop these medicines, these blood thinners, at least 7 days before the procedure in consultation and supervision of the patient's cardiologist. So in the immunological category, we have psoriasis, which is pretty commonly found nowadays. And when they appear in copious amount in the scalp donor area, the patient is not fit for a procedure using either technique of FUT or FUE. And then we have alopecia areata, in which coin-shaped patches of hair loss keep appearing and healing all over the scalp. When these alopecia patches are either too many or they are still florid, they're not quiescent, the patient is not fit for a procedure. One odd quiescent stable alopecia areata patch does not cause any problem and the patient is fit for procedure. But when they occur in large numbers and or they are red, they are florid, the disease is active, that is the time the patient is not fit for hair transplant and the procedure should be postponed. And then we have infective conditions like folliculitis, which is the commonest, and certain fungal infections, which are quite common in the scalp. And then we have scarring. See, this is the largest number of patients who come to us where the donor area is scarred, compromised the scalp donor for future procedures, and it is because of past procedures of either FUT or FUE, completely ravaged donor areas, leaving very little grafts for future procedures. And this is the most common cause today of a scalp donor area which is compromised, making the patient a poor candidate for a hair transplant. And the other causes of trauma are traction alopecia, because of constant pull on the hair leading to scar tissue formation and disruption of the follicular integrity leading to baldness. Then we must mention here obesity. Many patients who are obese, the scalp subcutaneous fat is also very loose and there is a lot of subcutaneous tissue. So as we discussed in the case of CVG earlier, here too targeting the nerves while instilling local anesthesia is difficult. Secondly, because of the loose folds, due to technical reasons, FUE cannot be performed as skillfully without causing too much of transection as it would be in a normal scalp skin. So these are certain technical difficulties in performing FUE hair transplant. And then those people who have had radiation to the scalp with permanent damage to the roots are not candidates for a hair transplant because the donor area is compromised. And then we have African races where the hair follicles have an S-shaped curve under the skin. And in these people, since FUE is a blind procedure, if the transection rate is high while trying to extract these curved follicles under the skin, the transection rate that we can accept when it is exceeded, there is no point doing hair transplant and spoiling the procedure. And lastly, we come to color. The color contrast between the skin on one hand and the hair on the other. So whenever there is a lot of color contrast, this can happen normally in certain races which have dark skin and dark hair, or when a patient has received scalp micropigmentation for the back of the head, the transection rate can be little high. So these are relative contraindications towards an FUE procedure. And then we have another group nowadays which is increasingly common, people who tattoo the back of the head. In so tattooing the back of the head, they compromise their donor area, especially if the dye used is dark in color. It can give added difficulty in FUE technique. So there are other conditions as well, but these are the most common conditions which compromise the scalp donor, which I have brought out to you. If you have any other question about this talk, please drop a comment and I'll reply back to you the soonest. And please subscribe to my channel so that I get encouraged to post more and more videos for you. And have a nice day, stay safe, stay happy.